Goes through the loop. Well, okay, here we are. Is this a problem? Is this a problem?
Not yet.
Not yet, absolutely. Not yet. Am I in trouble?
No.
Not yet. Am I in trouble now? Not yet. Not yet. Could I be in trouble? Sure. Do you think the baby looks down and says, whoa, I made a knot in the cord. I better go back the other way. Do you think it does that? Not a chance. Once it goes through, the chances of going back the other way are 0. And as long as that knot is nice and loose like this, nothing happens. Do you think the baby does this? Whoa, knot in the cord. I think I'll kill myself. Do you think it does that? No. Absolutely not. Could it happen that the knot gets tight? Absolutely. Does it happen very often? No. But could it? Sure it could. Absolutely. So let me just take the knot out for a second and put it back there. And now the knot is gone. Do you think the baby sometimes grabs onto the cord? Because this is pulsating, right? The baby's heart is beating, and it's pushing blood to the placenta, and then blood is coming back through the cord to the baby with nutrients, right? With food and with oxygen. Carbon dioxide is going that way, wastes are going that way, and food is coming this way, right? Mama eats, baby eats. Mama doesn't eat, baby still eats, right? Baby's getting oxygen. Do you think, and it's pulsating, you think the baby feels that? Sure it does. And sometimes you think the baby, I mean, if you do ultrasounds, you see the baby do all kinds of weird things. Does this, does that, does this. If you see a baby with its hands down here, it's almost for sure a boy, right? It's saying, I got one, I know where it is, I'm going to keep it. You think the baby grabs onto things? Sure it does. Does it grab onto the cord? Yeah. And when a baby's born, I mean, one of the very first things you do is you put your finger in the baby's hands and it grabs on, and they're really quite strong, right? So it grabs. You think the baby grabs the cord from time to time? Sure. And all of you have been in my office, and when I do that examination, right, and we listen to the baby, and it's going beat, 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 right? Sometimes you hear this. Beat, 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 and you're looking at me. What's going on, right? Beat, and I'm looking at you, right? It's going beat, 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 right? What's just happened? The baby's grabbed the cord. Maybe. I don't know. It's grabbed it, it's given it a good squeeze, cuts off its blood supply, gets a little dizzy. Let's go. A baby doesn't grab onto the cord and say, I'm going to kill myself, I'm holding onto this cord. It's not, that doesn't happen. It grabs on, it gets a little dizzy, and let's go. Does it happen? Sure. Absolutely. I'll bet it does. Because all kinds of things can happen in there. Well, okay, we talked about this situation, okay? And we agreed I'm not in trouble yet. How often does this happen? This happens often, okay? This is not cord around the neck. This is cord over the shoulder. Does it cause a problem? Usually not. Can it? It can. But okay. You can see what's coming. Let's just go around. There we go. Okay. Now what have we got?
Noose.
We have a noose, yeah? We have a cord around the neck. Is this a problem? Maybe. Right now, is it a problem? Nope. Is it affecting me in any way? Absolutely not. Twice. Is it a problem? No. Not yet. Is it a problem? Still not yet. As long as it's not tight, we're okay. More times it goes around the neck, the more the risk of a problem is, right? Right? So the longer the cord, the more likely the baby's going to get tangled up, right? It's the old story, give a guy enough rope, he'll hang himself, right? The longer the cord, potentially, the more risk. So cord around the neck is an issue. So let me tell you something. If the cord is around the neck, and we do an ultrasound, and we see the cord around the neck, and I'll tell you, we don't go looking for it specifically. But if we did, for whatever reason, an ultrasound, let's say at 32, 34 weeks, and the cord is around the neck, am I going to tell you? No. I'm not going to tell you because it's going to make you crazy. It's going to make you crazy. My baby has cord around the neck. Every time that baby doesn't move for 3 hours, you're going to be nuts. And here you are at 32 weeks, and what I'm going to do is I'm going to make you crazy for the next 8 weeks. I'm going to make you so crazy that every time you don't feel the baby move, you're going to phone him, and you're going to make him crazy, right? And your mom, and he's going to call me saying she's making me crazy. So I'm not going to tell you. So if I saw it around the neck, am I going to tell you, you know what, it's probably not going to make any difference? Would it make some difference at the time of delivery? Maybe. And it would be nice to know if we knew, but chances are it's not going to make any difference. Okay? So the longer the cord, the more likely the baby is somehow going to get tangled up. And I've seen babies really tangled up, around the neck, around the back, over a shoulder, twice around an arm, with a knot. Really cockeyed situations. And the most times I've seen the cord around the neck is 4 times, 4 loops. How miserable is that kid? This is a kid who's going to look for trouble all his life, right? I think I'll put the cord around my neck 4 times. Unusual. Okay? So cord over the shoulder, common. Cord around the neck, common. Cord around the neck twice, less common. 3 times, even less common. 4 times, really uncommon. Most of the time it doesn't cause any problems, but sometimes it can. And we're going to talk about those issues a little bit later on. The cord as well is twisted. Okay, when you look at the cord, it's got a twist in it. It's not lying there like a electrical cord. It's twisted because that baby is spinning around in there a lot. Okay, it always is twisted. And the length of the cord is usually, how long is the cord? And the answer is long enough, right? It's long enough because it needs to be long enough to come out. Once in a while, we see a really short cord. And can it cause a problem? Mm-hmm. And sometimes it does. Short cord is going to twist, but it's not going to allow the baby to get tangled up in it. But could it cause the placenta to separate? Possibly. Could it itself separate? Possibly. Could it restrict the baby from coming out? Possibly. So sometimes we see problems with a short cord. A long cord has the issue of baby getting tangled up in it, and once in a while, a real emergency, where here's what happens. So I'm going to disconnect myself from this right now. And here you are, and you're in labor, and the first thing that happens is we separate your legs, and there's the cord. Whoa, there's a big problem, prolapsed cord. And we're going to talk about that issue because that's a real obstetrical emergency. Okay? And as long as the cord is pulsating, we know the baby's alive. If that cord is not pulsating, baby's probably died. So, is this an issue? Yes. Can it happen? Yes. Do we see it? All the time. Do we see it often? We certainly don't see it often. But do we see it? Absolutely. And we're going to talk about this when we talk in the 3rd class about what if. Right? What if? Because this is a real class. It's taking place in real time. I don't know if I'm going to get called at any time. There can be a delivery or an emergency, and I get called out of here. And once in a while, I'm in my office or I'm in the hospital and we get an emergency call, any obstetrician to the labor room. That's always a grief call. Something bad has happened, and once in a while it's a prolapsed cord, and then everybody scrambles, and we'll talk about that situation. Okay? So let me just put this down for a minute. So baby and placenta and cord. That baby is growing. At around 20 weeks, your baby weighs 1 pound. You're up 20, baby weighs 1. That's it, 500 grams. At 28 weeks, your baby now weighs 1 kilo. You're up 30. Your baby weighs 2 pounds, 2 ounces, approximately. By 32 weeks, your baby has doubled and it's now around 4 pounds. And by term, another 8 weeks, your baby's going to double again to about 7 or 8 pounds. So in the last 8 weeks of the pregnancy, your baby's going to gain about 1/2 pound a week, while you're gaining 2 pounds a week, right? So here's the process. You came in, I examined you the first time when you came in, and I weighed you. I wrote it down, right? And I asked you a bunch of questions, and I examined you to see how big the uterus was. And at the same time I examined you, I determined the position of the uterus, and I tried as best I could to determine how much room you had there. What was the size of your pelvis? And I would write in my chart, average pelvis, or I might draw a picture of an 18-wheel truck. Truck can go through here, right? That's what you want. You want to have a pelvis big enough that you can drive a truck through. Or I might write, no way, Jose. Right? She hasn't got room to deliver anything but a peanut. Okay? And I will tell you. I'm not going to keep any secrets from you. I'm going to tell you as we go along exactly what I feel. And each time you come to a succeeding visit, we went through a dance, right? We went through exactly the same process each time. You'd come in, and the first thing I would do is weigh you. I'd write it down. And if you were bad, I told you, right? If you gained 5 kilos in a visit, 11 pounds in a month, I let you have it with both barrels, right? I warn you, do not look for trouble. And if you gain a ton of weight, you are the one who has to lose that weight. So I weighed you. And I asked you to give me a urine specimen each time. And if you didn't bring one, I made you go out and get one, right? And each time I test that urine. And you see me test it, right? We do it right there in the room, test it right away, and we're testing it for protein to make sure that your kidneys aren't leaking protein, and we're going to talk about the significance of that later on. And we test it for sugar to make sure that you're not becoming a diabetic, and we'll talk about that issue also. And then you got on the table, and you lie down, and I took your blood pressure. And then we would feel the size of the uterus to see that it's growing, right? To see that it's the size that it ought to be for the stage of pregnancy that you're at, and I would make a note. And then we would try and feel the position of the baby. And at around 28 weeks, if you're not too big, I can start to feel the position of the baby. Before that, the baby's head is small, and what I'm feeling for is I'm feeling for the head, right? And early on, that baby's head is really small and, size of a ping pong ball. I can't feel a ping pong ball in there. But at around 28 weeks, your baby's head is about the size of a hardball, size of a baseball. And that's about the smallest that I can feel, and sometimes I can feel the position of the baby, and I'll tell you. And then later on, as the head grows, it's easier to tell the position of the baby. And once in a while, we're wrong. Once in a while, I'll tell you the baby is head first, and I'm wrong. How often does that happen? Not very often. But does it happen? Absolutely. Girl comes in labor, and she turns out to have a breech. And last week it was head first. I told you it was head first. Chances are I was wrong. It happens once in a while. Okay? So position can sometimes be a little tricky to determine. Most of the time we can tell. So the baby is growing, and I'm making notes as to how the baby is growing. And then we listen to the baby's heart, right? That's the last thing we do, is we listen to it. And from about 13, 14, 15 weeks on, we can hear the baby, because now the uterus has risen up out of the pelvis, and we can hear it, and we listen every single time, right? And sometimes it takes a few moments to find it, but we find it. Agreed? And that's the process. And so with each visit that you come to see me, you're with me for about 3 minutes, right? 3 or 4 minutes at the very most. You've been waiting for me for an hour. You see me for 3 minutes. First visit was about 10 or 15 minutes. Closer to 10 than to 15, true? Probably. But each of the other visits about 3 minutes. So here you are, think about this. You're going through this whole pregnancy, and let's say 15 minutes for the first visit, and let's say you come and see me 12 times throughout the pregnancy, right? Every 4 weeks until 28 weeks, then every 2 weeks until 36 weeks, and then every 1 week till we have the baby, and you're in the office maybe 12, 13 times. 12 times 3 is about 36. Add it to 15. were around 50 minutes, less than an hour. So the whole time that you spend with me during this whole pregnancy is less than an hour in the office. How well do you think you can know me in 50 minutes, 3 minutes at a time? Not very well. Agreed? And we're going to have a baby with a stranger. True? This is an issue. How well can you know your doctor 3 minutes at a time? Right? He hardly has time to talk to you, right? It's like in, out, next. You're going to work, you've been waiting for an hour, you need to go to work, and that's exactly the transaction that takes place. It's a problem. We're going to spend about 10 hours together in this class, and you're going to have a much better feel for who I am and what I think about when we're done. Agreed? And especially the guys, right? Sometimes the guys come along to the visits. That's great if they can do that. And sometimes I meet them for the first time in the class, and sometimes I meet them for the first time in the delivery room. Sometimes I don't meet them at all. That can be a problem too. So we're going to spend some time together over this next little while, and we're going to talk about a lot of different issues. So the baby's growing. The baby's moving. And things have changed. Your body's not the same. You aren't the same. Things hurt that didn't hurt before. Your back hurts. You have cramps. So a little story. Yesterday, I got a phone call about one of my patients who came in here yesterday, and the story was that she was driving her car and she got a cramp and she lost control of the car and drove through a store window. This was yesterday. Okay? Every story, let me just tell you one other thing. Every story that I tell you will be true. I'm not going to tell you their names, it's not important to you, but I'm not going to make up anything. Every single story that I tell you is based on experience, because I've done this a few times. This is now 30 years and 15,000 babies later, so there are a few stories for me to tell. So she drove her car through a store window yesterday. That was the phone call. She's fine. And they took her to emergency just to check her. She's perfectly okay. We listened to the baby. She smashed up the car. Worse, she smashed up the store. The insurance company is going to have an interesting time with this one. And the only message I got sent back was, take her license away. You're not driving anymore. He's going to take her license away. So do things happen? Sure. Absolutely things happen. Your body has changed. All kinds of things have changed. Your weight has increased. How much weight do you really need to gain in a normal pregnancy? How much weight do you really need to gain? Well, your baby's going to be about, let's say, 7 or 8 pounds, and the placenta is going to be another 2 pounds and a little bit. So we're about 9, 10. And there's going to be about a liter of amniotic fluid. A liter is a kilo is 2 pounds. We're up to about 12. The uterus itself, which was a tiny little thing like this, is going to be big. Maybe there's going to be another 2 or 3 pounds of uterus. We're up to about 15. Those are a little bigger. There's another pound or 2 there. We're up to 16, 17. We got a little heavy-duty suspension, right? So there's a little bit there. And the amount of blood that you have circulating in your body has increased by 50% by 28 weeks. So there's a little more blood. There's more fluid. How much do you really need? You need to gain, in a normal pregnancy, about 20, 25 pounds. And if you can go through the pregnancy at 20, 25 pounds, you're going to feel great. You're going to look great. You're going to lose all that weight. And for most of you who are now around 28, 30 weeks into the pregnancy, you've already gained that. And most girls are not going to gain 25 pounds. They're going to gain 30 or 35 or 40 or 45 or 50 or more. And I have someone in my practice who in each pregnancy gained 100 pounds. Every time she'd come in, she'd be up 7 or 8 pounds or more, and I would yell at her, and she would say, "It's okay, I'll lose it." And at the end of the pregnancy, she would spit out a 6.5 pound baby, 100 pounds later. And then she'd lose the weight. But it's going to hang, right? It's going to be an issue. It's really hard to gain 100 pounds, lose 100 pounds, and expect that things are going to look normal. They're not. So try to protect yourself as best you can. This is Canada. There's lots of food. And there's lots of bad food. All right? So try to eat for one. I know you're going to your mom's. or to your mother-in-laws, and they're putting food in front of you saying, eat. It's for the baby. Please, please protect yourself as best you can. I do not want you to gain a ton. If you gain a ton, you need to lose a ton. You're going to complain of pain. You're going to complain of back pain, and all of that is normal in pregnancy. Your whole anatomy changes to make an accommodation for this baby. Remember, your intestines are still in here, and ordinarily they fill your whole abdomen. And now this uterus, bless you, this uterus is growing, and it's starting to push things out of the way. And your small bowel is all the way up here, and your intestine is pushed up to that side, and you're getting constipated, and you're getting uncomfortable, and you're getting some heartburn, and gas pains, and all kinds of things. And this is a normal anatomic rearrangement, right? Everything is moving around because the baby says, I'm first. It's taking over your abdomen. It owns you. And it's going to push everything around. So you're going to get some back pain, and you're going to get back pain because your ligaments have softened a little bit, and you're going over like this, and in order to compensate, you are pushing your back out like that, and that's what causes the low back discomfort, right? There's nothing that you can do about it. You're just going to have to roll with it as best you can. Your breasts are growing. They're heavier. Wear a bra all the time. Your breasts have no muscle and no ligament. They are just fat and secretory tissue, and as they get heavier, they go south. Anything that goes south never goes north again. Wear a bra and protect yourself. You may see some veins on the surface of your breast. It's normal. You may see them on your abdomen as well. The nipples are going to get darker. That's in response to hormones, and some of you are going to get a line down the middle called the linea nigra. It's a hormonal change in your skin. It may fade, it may not. So some of you are going to get that. Some of you will get stretch marks, and stretch marks are an issue. And some girls spend all kinds of money on creams and lotions and stuff to try and prevent stretch marks. So let me tell you something about stretch marks. If you want to know if you're going to get them or not, go home and look at Mama. Go pull up Mama's dress, say, Mama, I need to know if you have stretch marks, and if Mommy has stretch marks, you're probably going to get them. And if your sister has stretch marks too, you're going to get them for sure. If Mommy doesn't have any stretch marks, there's a good chance you may not get any. And you've got great elastic tissue, because it's all about elastin. It's all about elastic tissue. And if you've got great elastic tissue, it'll stretch nicely, no matter how big you get, and you'll have no stretch marks. But if you don't, you're going to get some stretch marks. And they're going to occur lower in the low abdomen first, and there'll be little red things that you'll see first, and then they'll get wider, and they'll get bigger, and there'll be more of them, and then they'll start to creep up your abdomen, and you may get them in the whole lower abdomen and the upper abdomen. And if you're really not lucky, you'll get them on your breasts, and under your arms, and on your legs, and on your bum, and on your back, and you'll be stretch mark heaven. Will they go away? No. Will they fade? Yes. No amount of sandpaper is going to take them out. Just let it be. Whatever happens in that first pregnancy is what's going to happen. Will you get more stretch marks in a second pregnancy? Probably not. So whatever you get in your first pregnancy, that's what you get, and they're battle scars, and just let it be. Do not spend money on creams and lotions and whatever to try and protect yourself. It's not going to help. The stretching is not in the epidermis, it's not on the outside, it's on the dermis, in the dermis underneath where the elastic tissue is. And what you're seeing is you're seeing the little blood vessels underneath, and that's what makes it pink. And sometimes they're a little itchy. Just deal with it as best you can, and don't fuss over it, and let it be. Bigger issues than stretch marks and breasts getting bigger are veins. And that's a real issue. So varicose veins, and attached to that same problem, hemorrhoids. Two really big problems. Men get varicose veins, but they get them much less frequently than women because men don't have babies. And men get hemorrhoids also, but again, not nearly with the frequency that girls get them. And hemorrhoids and veins are an issue. And here's why. First of all, by 28 weeks, you have 50% more blood circulating in your body. You make more blood because at the time of delivery, you're going to lose some blood. And your body protects you. by making more. So it's easier and safer for you if you bleed from this level than if you bleed from that level. Your hemoglobin falls a little bit during pregnancy. Some girls are iron deficient, not everyone. And most of you are taking vitamins with iron in it to try and protect you as best we can. But your hemoglobin's going to fall a little bit. You make more blood, but you make more fluid than cells, and so the blood is a little bit thinner, but you have more of it. That blood has to go somewhere. And here's what happens. Arteries take blood away from the heart. And right at about the level of your umbilicus, the aorta, which is the big blood vessel that takes blood away from your heart, splits. And then right down here, it splits again. And one of the big blood vessels feeds all the pelvic organs, and the other one goes down into your legs. So the internal iliac, it divides into the common iliac, and then the internal iliac and the external iliac. The internal iliac goes to the pelvis, the uterine artery comes off that, and then the external iliac goes down into your legs, and it's taking blood away from the heart. And veins are paired with the arteries, and they bring blood back to the heart. Now, arteries are thick-walled, high-pressure vessels. Thick-walled, high-pressure, and they do not swell. If you cut an artery, the pressure is high and the blood will squirt. It will hit you over there. And if you cut an artery and you put your finger on it, you may not be able to stop the bleeding. You have to come to the hospital. It's got to get tied off. It has to be repaired properly because you'll bleed out. If you cut a vein, blood will drip on the floor, and you can put pressure on it. And if it's a small one, it'll stop. And if it's lots, you got to come to the hospital, and we got to tie it off or repair it. But you can put pressure on it and stop the bleeding, because veins are low pressure and they expand, they enlarge. And because blood only goes in one direction in arteries, there are no valves. But veins have valves in them because blood is coming back to the heart, and the valves point towards the heart and they stretch. And when a valve finally tears because it's too stretched, blood can go both ways, and now you've got a varicose vein. So the veins stretch, and you can see at the end of a day how your legs are a little swollen because blood has come down to your legs and fluid has come out. And then what do you do at the end of the day? You lie down. And if you lie down on the left side, you take pressure off the big vein, which brings blood back to the heart. Here's this big uterus, which is sitting on the blood vessels and compressing them. So blood is going easily that way, and it's having a harder time coming back because the uterus is compressing it. And that inferior vena cava, which is bringing blood back to the heart, is sitting slightly to the right, and the aorta is slightly to the left, and so you lie down on the left side. And blood now takes the uterus off the vessels, and blood can come back to the heart. The heart now pumps it to the kidneys, and half an hour after you've gone to lie down, you get up and you pee. And then you lie down again, and an hour later you pee again. And then you lie down, and an hour later you're peeing, and you're peeing all night, right? And in the morning, you can see your ankles again. And then you go through the whole process, right? All of this swelling is pretty physiologic. It's pretty normal. But what it's doing is it's stretching the veins. And sometimes the veins tear. And you can see the big blood vessels in the back of the legs. And you look at your mom or other women that are walking on the street, and you're walking behind them, and you can see these great big pipes, vessels the size of your thumb, on the back of their legs. These are varicose veins, right? They may or may not cause an issue. Cosmetic? Absolutely. You look at them and you say, oh my God, that's terrible. Is that going to happen to me? And the answer is, maybe. Again, go home and look at mom. If mom's got varicose veins, she's got terrible legs, and she had to have them fixed, she had surgery on her veins, or if she didn't, chances are you're going to get varicose veins. Are they an issue? Yes and no. We're not talking about the little spiders that you sometimes get on your thigh or on your breasts or sometimes on your face. Those ones may or may not disappear, but those are tiny. We're talking about those great big veins that you see on the back. Will they get better after the pregnancy? 100% for sure. Will they disappear? No. Will they get better? Yes. Will they disappear? No. Will they get worse in the second pregnancy? Put money on it. For sure. Third, fourth pregnancy? Absolutely. And sometimes I see terrible varicose veins, huge ones on their legs and great big ones on the labia, because that whole area is full of veins, and sometimes it's an issue. Okay? Will they get better? Yes. Will they disappear? No. But tied to that is just as big an issue, and that's hemorrhoids. And hemorrhoids are great big perirectal veins, great big veins around the rectum. Girls get them because they get constipated, and they're sitting in the toilet with a Vogue magazine, a 900-page Vogue magazine, right? Trying to read the whole magazine, and they're in the toilet for an hour. Is that going to cause a problem? Mm-hmm. And that big pregnancy is pushing down on those veins, and some girls have hemorrhoids. Not everybody gets them, but some do, and some are terrible. And if you walk into my office and you see somebody walking in like this, what's she got? She's got hemorrhoids. And when she sits down, she doesn't sit like this on the chair. She sits sideways, right? Are they a problem? Sure. Yes?
When will you notice them?
You'll notice them. You'll go to the toilet and you'll put your hand down there and you'll say, "Where did I get that chestnut?" You'll notice. It'll hurt. It'll bleed, maybe. It'll itch. And for sure, you're going to feel a bump there. And if you get a hemorrhoid, shove it back in. Put your finger on it and push it back in. Then go wash your hands. If he gets a hemorrhoid, don't push his in. Let him push it in himself. But if you get one, try to push it in, because if it stays out, it gets itchy, it bleeds, it swells, and it hurts. And once in a while, we have girls come into the office, and they've got a clot. They've got what's called a thrombosed hemorrhoid. And she's walking in like this. That hurts. But there's a clot in that hemorrhoid, and it's not going to get absorbed in the next little while. It causes pain. And so what do? We take her over to the emergency department. We spray it with some freezing and then cut the vein open. Just use a knife, cut it open, and the clot pops out, and she dances out of the emergency department. She's so happy. Does it happen? Absolutely. If you can't push them in and they stay out, you're stuck. Does Preparation H or Anusol or any of the preparations that are available, do they make a difference? Yes and no. If they're small, sometimes it makes a difference, especially if you can push them inside. But if they're out and they're constantly out, will any of these preparations make a difference? Absolutely not. Absolutely not. It will be an issue until you have the baby. It may or may not be an issue at the time of delivery. Some girls are afraid to push because the hemorrhoids are going to get worse. Will they? They might. Will there be bleeding? Uncommonly, but possibly. Will they get smaller after you have the baby? Yes, 100% for sure. They'll get smaller. Will they disappear? Maybe. Possibly not. Will they be an issue later on in the next pregnancy? Again, put money on it. If you got hemorrhoids in the first pregnancy, you're going to get them in the second pregnancy, and they're going to be worse in the third. If you need to fix them, hang on for one sec. If you need to fix them, or if you need to fix varicose veins because of phlebitis or other issues or cosmetic issues, you're not going to fix them until after you've had all your babies. When your family is finished, at that point, you can consider doing it. Because if you strip varicose veins and get pregnant again, you're going to get others. And you've only got so many veins. You don't want to do this. And for sure, you don't want to operate on hemorrhoids until after you're finished having all of your children. So can they be fixed? Yes. Do you need to fix them? Sometimes yes and sometimes no. What was your question?
Can anal fissures or tears that bleed occasionally ever lead to hemorrhoids?
They're not related.
Something different
No,
altogether.
there's something entirely different, completely different. And usually, sometimes a fissure will heal, sometimes it will not, and you need to excise it and sew it together properly. So sometimes they need to be fixed separately, but they're caused by entirely different issues. Because girls can develop a fissure that has nothing to do with pregnancy. They're not pregnant at all. But hemorrhoids, much of the time, are caused by the pregnancy. Okay? Will they get better? Yes. Will they disappear? Maybe, maybe not. Okay? So it's a legitimate issue. Okay? And it causes, I think, a considerable amount of concern. All right? Fair? Baby's growing. It's lining itself up. Starting to get into position. starting to move, okay? And then it's going to move more, and you're going to feel this baby moving all of the time. All of the time doesn't mean every minute, but the baby should move every day. It should move multiple times during the day, okay? If it's not moving, we have an issue. Don't wait for a week. I mean, sometimes I see weird things. Girl comes into the office, says, I haven't felt, she's 37 weeks, says, I haven't felt my baby move in a week. What are you thinking about? Okay? That baby should be moving. If it's not moving, shake it up. Wake it up. Make a move. Okay? That baby should move. All right? If it's not, I need to know about it. All right? You're going to have contractions from time to time. We're going to talk about that when we talk next week about the labor, but you're going to feel contractions from time to time, and that's normal. These are Braxton Hicks contractions. They are part of the normal pregnancy. Okay? As you're getting farther into the pregnancy, the uterus is getting more sensitive to oxytocin, and it's starting to contract from time to time. And you'll feel the baby move. And it's flipping around early on. Later on, it's settled into position, and it's sort of rotating. By around 28 weeks, it started to settle into position. And before it was using the uterus like a swimming pool, and now it's using it more like a bath. Okay? And you know, when you're taking a bath in a normal bath, not one of those great big whirlpools that uses all the water that you have in the house, right? That you never use. You got this great big whirlpool upstairs, and you're afraid to fill it, because if you fill it, you think it's going to go right through the floor. And if it hasn't been built properly, it will. And you're going to use up all the hot water to fill this whirlpool, and then you can, you can turn around in it. But in a normal bath, if you want to turn around, you have to stand up, turn around, sit down, right? And that's what's happening at around 20, 30, 32 weeks. Once you get up to about 36 weeks, it's more like a wet towel. You take the towel, drop it in the water, take that soaking wet towel, wrap yourself up around in it. Can you still squirm around in it? Absolutely. Can you do a somersault? Nah. Right? So the movements change, right? As you're getting a little bit farther on, the baby is moving, but now it's squirming, right? And it's rotating. It's turning from side to side, and you're getting the odd contraction. And sometimes you feel a little bit of discomfort. And once in a while, you might feel a sharp pain. And it's almost always a ligamentous pain. It lasts for a few moments. It passes. You're going to get some back pain. All of this is normal. Can you sleep on your back? Absolutely, you can sleep on your back, because you're going to move. Nobody sleeps on their back the whole night. I tell everybody, if you go to sleep on your back and you don't move, and in the morning you're still on your back, you're dead. People move, and you're going to get up to go. How many times do you get up to go to the bathroom at night when you're farther along in the pregnancy? 4 times, 5 times. Right? You're up every couple of hours. Nobody sleeps through the whole night late in their pregnancy. It just doesn't happen. You're up all the time. So can you lie on your back? Sure, because you're not going to be on your back for very long. Okay? The only time that we don't leave you on your back for a long time is when you're in labor and you've had an epidural and now you can't move, and now we're going to turn you from side to side. That's the only time. Can you go in a whirlpool? Sure. Can you go in a sauna? Absolutely. Can you take a sauna during pregnancy? Absolutely. Our body temperature normally is 37 degrees centigrade, right? And our body is kept pretty much at that temperature. And we as humans live in a very narrow temperature zone. Once we get up to about 39, 40 degrees, we have a fever. We're sick. We feel hot. We're sweating. Once you get up to about 41, you're really sick. And at 42, you convulse. And similarly, as your temperature drops, you get down to about 35, you're starting to shiver, you get down to about 34, 33, you're in trouble and you might lose consciousness. So our enzymes that keep us alive work in a very narrow temperature range. When you go into a sauna, the sauna is hot. It can be really hot, especially if it's a wet sauna, right? Where there's steam. We're not talking about a dry sauna. It's a wet sauna. And you go in and you get hot and you start to sweat. Your body is sweating. It is protecting your temperature. Does your temperature go up at all? Maybe a little bit. Not much. You feel a little hot. You feel a little dry. Out you come, and you take a shower and you cool off. Could you go back in? Sure. So can you take a sauna? Yes. But if somebody closes the door on you, you're going to cook. Remember, it's 160 degrees in there, and it's steam. You're going to be steamed. So if you're going to go into a sauna, make sure nobody locks you in. Yes, Julia?
For how long can you go into the sauna or a hot jacuzzi?
As long as you want. Okay? Can you go into a jacuzzi that's 102 degrees? Sure. As long as you're comfortable in there and you don't feel like it's burning, absolutely you can stay in there. You're not going to cook the baby.
What about after the sauna? You know how some people come out and they take a cold shower?
It's of no consequence to the baby. Your baby is protected inside there, and its temperature is not going to change much either way. Okay, so you can do either. Can you swim? Can you run? Can you exercise during pregnancy? If that's what you normally do, yes. But if you've never exercised, don't come to me and say, can I start exercising in pregnancy? What are you thinking about? Okay, this is not the time to go skiing unless you're a skier. It's not the time to go water skiing if you've never tried it before. But if you're a water skier and you don't fall and you know what you're doing, can you water ski? Sure. Can you go skiing in the winter as long as you don't fall? Sure. You don't do dumb things. Okay? So, low impact exercise, absolutely. Best exercise, speed walk. Put on a pair of running shoes, go for a good hard walk. Half an hour, 40 minutes, is that going to be good for you? Absolutely. Will it harm the baby? Not even one bit. Okay? Not even a bit. And should you do it? Absolutely. Okay? Absolutely. Yes.
Is there some exercises that are better than others?
I don't think so. I think the best thing you can do is low impact stuff. Okay, so can you do weights? Absolutely. Can you go on a treadmill? Yes. Can you go on an elliptical? Yes. Can you do a step class? I think better that you don't. Okay? Step classes traditionally, people fall. They trip. And you don't want to trip in pregnancy. Everybody's going to run over to you and they're going to take you by ambulance to the hospital. Right? They're going to panic. Don't do it. Okay? You want to do stuff that's low risk, that still gives you cardio, right? That still burns calories, but you don't want to put yourself at any increased risk. I try to remind you and I say, you're pregnant, you're not sick. Could you become sick? Absolutely. So you want to be careful. Okay? So don't put yourself at any increased risk. And putting on a pair of running shoes and going for a brisk walk, I don't think that's putting you at any increased risk. Okay? Yes?
I've heard that it's good to go to the pools when you're pregnant and be in the water, but why is it good? Like, does it make a difference?
No, I don't think it makes any difference. Can you swim? That's your question is, can I go swimming? And swimming is just exercise. Is that going to harm the baby in any way? Absolutely not. Okay? Can you have sex during pregnancy? That's exercise too. Mostly for him. The answer is as long as you're comfortable. Okay? As long as there's no bleeding. As long as you're comfortable, yes, you can have sex. Can you have an orgasm? Yes. If you have them, good for you. If you don't, too bad. They're not going to be any more or any less afterwards. So yes, you can have sex. When you come to the hospital, you have to stop. Okay? No sex in the labor room, please. Okay? Last time in the car before you get out, that's it. Okay, that's all right by me. But once you get here, I don't want to hear about it. Okay? So as long as there's no bleeding and as long as you're comfortable, sure you can. Okay? You're normal. All right? Your turn. Questions now. What else do you want to hear about today? Yes?
Can prenatal yoga help with pregnancy?
I think any exercises that you do are going to help. They're going to be better for your